Well, I offer my welcome as well and bid you a great good morning. If you got trapped in the Thompson Bridge Road rush 10 minutes like I did, there's a 10-minute window in there. You just need to stay home and drink your coffee or leave before. But I'm going to feel a lot better about that Thompson Road 10 minutes because later in the day I have to drive to Atlanta and then try to get home, before midnight. So we don't think about how wonderful our community is until we step outside. Well, Brenau is in the midst of both a growth and a quality enhancement program for our entire educational process. We were just discussing right before we started officially that we're pushing 500 employees right now, depending on how the employees come out in the audit for the new law. We may or may not go over that magic number. But when I came in 2005, we were in the low 200s that were employees that had to be included in health care and benefits. So in this time, not only have we grown in the student numbers, but we've grown substantially in the employees that are covered by our benefits. And of course, that affects us like it affects all of you. Brenau this year will be educating students in 5 different venues across the state of Georgia. We're teaching nursing, occupational therapy, and other health-related areas, physician's assistants, at 3 venues across the state. Within 2 years, we'll also be starting a campus in Jacksonville, Florida. Nursing will eventually, and hopefully the therapeutic sciences will also be taught there as well. So we are going to 5,000 students. Half of those students will be graduate students. Half will be undergraduates. By the end of this year, we will have 3,000 students. Today, we have over 1,050 graduate students, all in healthcare-related fields, business, and teacher education. So what's Brenau to you? Brenau to you is that little school that's always existed across the street, if you've been here in Gainesville for a long time, where rich girls go to school. That's what I hear when I go to visit an alum that hasn't been back to Gainesville in 30 years or so. And I guess maybe that is what Brenau used to be. It was never that as long as I've been here. But as I said, Brenau is a school today which has as its heart and soul this liberal arts experience which we treasure and will always preserve, and that's the Women's College. But we understand that the future of education is both career-driven and societal need-driven. So all of our career programs, all of our graduate programs are pre-professional programs. We're not a Research One institution. We're a liberal arts graduate school. So hence we have one of the most diverse offerings in healthcare programs outside of a school which has an MD in the South. You're going to see if you wander around, especially if you look down the long hall that goes towards what used to be the arena, some folks were putting up plexiglass in some framed walls that they were literally installing yesterday. That area will be a clinic, a public clinic for physical therapy for underserved and unserved peoples that will be staffed by the Brenau faculty, staff, and students taking physical therapy in this building. We plan to enroll our first physical therapy program class just as soon as we get through the accreditation hoops that have to be completed in order for us to offer them accredited education. That could be anywhere from 12 to 18 months, depending upon the speed of the motion through the bureaucratic hoops, and it's anyone's guess. We've hired one of the senior and most respected, we have therapy for that. Most senior leaders in physical therapy from the University of Florida School of Physical Therapy to be our inaugural director, and she has brought with her the second most senior professor from the University of Florida in physical therapy, to be our clinical placements director. And those are the two critical positions to begin your faculty and your staff. So they are in place, working at Brenau, and can't wait for the front of the building to be finished. With $1.5 million from the Woodruff Foundations, really from the foundation that composes the Letty Pate Whitehead Foundation, we are equipping this physical therapy program and our regional campuses with cutting-edge digital communications and educational technology related to the therapeutic sciences. So when we get all of that installed, sometime next semester, we're going to have a grand opening for this facility, and you're all invited back then to see things up and working. Now, you know, it wouldn't be Brenau if we didn't have art on the walls as well. Jack Bird and I traveled to New York to consummate some gifts that we had been working on in art about 3 months ago. And we returned with, I don't know, 75 pieces of fine art valued at about $1 million. And we are going to use those pieces of art and the abundant wall space in the downtown center as the New York Gallery. So when we open and have our gala in the spring, we will have these artists visiting here, and we'll be celebrating, in reality, the art and science of Brenau University. So I want you all to see that as well. My daughter's an OBGYN. My son's a dentist. My son-in-law is a non-practicing physician who works for Bristol Myers Squibb in pharmaceutical development. And my daughter-in-law is a pediatric dentist. They're a little bit concerned about healthcare reform. My family has definitely trickle-down influence in our lives by healthcare reform. All of those active practitioners tell me that they see healthcare reform as a two-pronged question. And I think we all do. We just need to get it out on the table. One is the treatment, care, and effective disposition of clients and patients, which is totally separate in both attitude and application from the bureaucracy, the regulation, and the governmental control. Now, it may be governed by it, but it is separate because we are the responsible parties in the care and healing touch. Then the second component is obviously, what in the heck are we going to do next year and the year after? You know, right now, our benefits advisor from Atlanta says, looks like next year is going to be okay for Brenau. The problem is we have no idea what's going to happen the year after. So I know you'll have an interesting discussion on both of those sides today. I'll tell you what, I really look forward visiting friends and families when they're in the hospital or at a clinic, when I know a nurse, a doctor, a technician has been part of a program that has trained them in both the value of life and the value of effective treatment. And from all of the institutions that are involved up here, from the hospital and their systems of clinics to the universities and technical schools, I really think Northeast Georgia has the best quality of health care and hence life of any place in the Southeast. And I'm excited to be here. I hope you all have a great day. Thanks for visiting us, and come back again. And don't forget the John Gerard concert on the front lawn of Brenau Saturday night. It's going to be a great time. Thank you all.